Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well crafted summary and it highlights only the important keywords. Drugs for dry cough. So, under the drugs for dry cough, it includes opioids. Opioids are used for the dry cough. They are codeine, codeine. Also, it includes the levopropoxy, levopropoxyphene. The adverse effects, it includes they are sedation. So it includes sedation, it includes constipation, it includes the possible abuse, and the high doses can cause the respiratory. So there is respiratory depression as well, which can occur, and thus they are not used in case of the pediatric population. Next is the NMDA antagonist. NMDA antagonist is nothing but the dextromethorphan. Dextromethorphan, it includes the sedation, also it includes abuse as well as the respiratory depression, and it can be used in case of the children. Then we look at the benzonatate. Benzonatate is nothing but a local anesthetic, and it has two main actions. That is, in the brain, it acts as a central mechanism to suppress the cough, and then when you look at the lungs, it is peripheral mechanism, and this will be inhibiting. It inhibits the peripheral lung stretch receptors. To learn and grow daily like this, please do subscribe.